Ever looked at the fine print on your prescription bottle and thought, wait, this can cause what? We've all skimmed those tiny labels without really absorbing the scary stuff. But one side effect worth paying attention to is blood clots. Yep, those clumps of blood that can go from a minor inconvenience to a major life-threatening issue if they end up in places like your lungs, brain, or heart. This isn't meant to scare you away from taking necessary medications, but knowledge is power. Some meds that help with everyday issues like pain, hormones, or even mental health can quietly raise your risk of blood clots. So, let's take a look at the top 10 medications that might do just that, and what you can do to stay safe. First off, not all blood clots are bad. When you get a cut, your body forms clots to stop the bleeding. That's a good thing. But problems happen when clots form where they shouldn't, like deep inside your veins. These rogue clots can block blood flow and cause serious conditions like deep vein thrombosis, DVT, pulmonary embolism, PE, or even stroke. Medications can play a sneaky role in this. Some mess with your hormones, others thicken your blood or slow your circulation. Understanding how and why clots form makes it easier to spot warning signs like sudden swelling, pain in the leg, chest pain, or difficulty breathing, and know when it's time to call the doctor. Number 1. Hormonal birth control, oral contraceptives, and patches. Birth control is super convenient, but if it contains estrogen, it can also raise your risk of blood clots. The hormone can make your blood a little thicker and more prone to clotting. While the overall risk is still low for most people, it jumps up if you smoke, are over 35, or have a family history of clots. If you're worried, don't panic. There are tons of options out there, including low-dose or progestin-only birth control methods that carry a lower clotting risk. The key is talking to your doctor and figuring out what's best for your body and lifestyle. Number 2. Hormone replacement therapy. HRT can be a lifesaver when you're dealing with the hot flashes, mood swings, and other fun surprises that come with menopause. But just like birth control, HRT often contains estrogen, which can increase the likelihood of developing blood clots, especially if taken for a long time. That doesn't mean you have to suffer through menopause without any help. Newer forms of HRT or non-hormonal treatments may offer relief with fewer risks. It's all about balancing benefits and risks based on your health history. Number 3. Tamoxifen. Tamoxifen is commonly prescribed for breast cancer treatment and prevention, particularly for hormone receptor-positive cancers. It works by blocking estrogen's effects in the breast, which helps stop cancer cells from growing. But like many hormone-related meds, it can also up the risk of clots, especially in the legs and lungs. It's a bit of a double-edged sword, but for many people, the benefits outweigh the risks. Still, it's important to be aware and keep an eye out for symptoms like leg pain or swelling, especially if you're on a long-term treatment plan. Number 4. Erythropoiesis-stimulating agents, ESAs. These meds are used to treat anemia, especially in people with chronic kidney disease or undergoing chemotherapy. ESAs work by encouraging your body to produce more red blood cells. But more red blood cells can mean thicker blood, and that can lead to clotting. If you're on an ESA, your doctor will monitor your blood levels carefully to make sure you're not overdoing it. Staying hydrated and reporting any unusual symptoms can also help you stay ahead of any complications. Number 5. COX-2 inhibitors, celecoxib. 2 inhibitors are a type of painkiller often used for arthritis and inflammation. They're gentler on the stomach than traditional NSAIDs, which is a win. But some studies have linked them to a higher risk of heart attacks and blood clots, particularly with long-term use. That doesn't mean you need to toss your pain meds. It's just a reminder to use them responsibly, at the lowest effective dose for the shortest amount of time. And of course, check in with your doctor if you've got any risk factors for heart disease or clotting. Number 6. Antipsychotic medications, risperidone, olanzapine. Antipsychotics can be essential for managing conditions like schizophrenia and bipolar disorder, but they come with some physical side effects too. Some can affect your metabolism, weight, and blood flow, all of which can make clots more likely to form. If you're taking one of these meds, regular checkups and blood work can help catch problems early. And don't skip your meds out of fear. It's all about monitoring and balance. Mental health is just as important as physical health. Number 7. Immunosuppressants. Thalidomide, lenalidomide. These heavy-duty drugs are often used for treating cancer or severe autoimmune diseases. Unfortunately, they're also known for raising the risk of blood clots, especially when combined with other treatments like steroids or chemotherapy. Because these drugs are usually prescribed in serious situations, the benefits often outweigh the risks, but it means you'll need close monitoring. Sometimes blood thinners are prescribed alongside to lower the chance of clotting. Number 8. Steroids, prednisone. Steroids can be miracle workers for inflammation, allergies, and immune conditions, but they're not without side effects. Long-term or high-dose use can increase the risk of blood clots, possibly due to changes in blood pressure and fluid retention. Short-term use usually isn't a problem, but if you're on steroids for a while, it's worth discussing the risks with your healthcare provider. Lifestyle tweaks like staying active and eating a balanced diet can go a long way in keeping things in check. Number 9. Cancer chemotherapy drugs. Cancer itself increases clot risk, and chemotherapy can make that risk even higher. Some chemo drugs damage blood vessel walls or reduce natural clot-fighting proteins in your body. Add in the fact that cancer patients are often less mobile, and it's a perfect storm. If you or someone you love is going through chemo, don't ignore swelling, pain, or unusual shortness of breath. Many oncologists preemptively use blood thinners or compression devices to manage this risk, so speak up and ask. Number 10. Testosterone therapy. Testosterone therapy is often used to treat low testosterone levels in men, which can boost energy, mood, and even muscle mass. But it can also stimulate red blood cell production, which thickens the blood and increases the risk of clots. This therapy isn't inherently dangerous, but it's not something to start without proper blood work and follow-up. Your doctor should keep an eye on your red blood cell counts to make sure you're staying in a healthy range. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications, and cheers to a healthy life.